Well, President Trump delivering on yet another campaign promise to give veterans more choice in their health care. According to a new report in the New York Times, the Department of Veterans Affairs is prepared to redirect billions of dollars from government-run vets hospitals into private care, setting the stage for the biggest transformation of the VA medical system yet. Here with Insight, Dan Caldwell, Executive Director for Concerned Veterans for America and a retired Marine and Iraq War vet. Dan, thanks for being here this morning. So the article says, effectively, as the rules are being written, veterans are going to have more options and choice to go to the private sector. Is that right?
That's correct. Now, just to be clear, these rules aren't final yet. You could have the D.C. swamp, the D.C. bureaucracy undermine them, but the things appear to be going in a direction where they will give veterans significantly more choice at the VA. And that's the key thing. They will have the choice between going to the VA or going to the private sector if the VA can't serve them in a timely manner. So you could have a lot of veterans choose to stay in the VA, but a lot of them will probably choose to go to the private sector.
Now critics will say you're going to have a lot of vets leaving the system, and the system won't be able to sustain that. How do you make sure vets get the choice and then the VA is able to maintain the specialties it does have?
First of all, that's very flawed thinking. It's not about saving the system or sustaining the bureaucracy. It's about serving the veteran. It's about what's best for the veteran. And ultimately, if more veterans choose to go to the private sector, then that's where the funding should go. The dollars should follow the veterans, and veterans should be able to vote with their feet. It's a very simple concept, and almost every other government-run health care program, whether it's Medicare or TRICARE, has some element of choice in it, except for the VA.
Well, Dan, TRICARE is a good example. That's what our retired military members use. It's a popular program because they have access to a system or they can go to the outside. So in many ways, this is similar, what they're trying to do at the VA, to what's done in TRICARE, right?
That's correct. The report says that TRICARE is serving as a model. It probably won't be an exact replication, but there's a lot of good lessons to learn from TRICARE for the VA, and I think that Secretary Wilkie and a lot of the people around him recognize that, and I think that they'll look at what went wrong and what went right when they implemented TRICARE about 2-3 decades ago.
Dan, you and I have done a lot of work on this issue. You talked to a lot of vets. Are vets going to like the option to choose? How popular is it?
Veterans want choice, and President Trump campaigned on choice. You heard him talking about choice at just about every campaign stomp right alongside the wall. And I think that's a big reason why veterans voted for President Trump overwhelmingly, I believe by about a 2-to-1 margin. And so veterans want it. They support it overwhelmingly, like by 90% in polling we've done and others. Yeah. And I think that ultimately they'll be very happy when they get more choice in the healthcare system, which President Trump says he wants to do.
Things like this are leaked to the New York Times because they want to make it look bad. But the irony is it actually makes him look good. VA to propose shift billions into private care. Doesn't matter where you get the care. It just matters that you get the best care anywhere. Dan Caldwell, thanks for your time.
Absolutely.
Appreciate it.
Thank you, Pete.
You got it.